average, 20 people die every day waiting for an organ transplant, and approximately every 10 minutes, another individual is added to the waiting list to receive an organ. Many individuals who are waiting an organ donation die before they receive an organ due to the organ shortage that we currently have in the United States, which is due to the amount of individuals that are not willing to donate their organs after death. I've spent several hours researching organ donation and transplantation. I'm a pre-med student, and I one day will possibly have to ask the loved ones of a deceased patient if they'd be willing to donate their loved one's organs, and I myself am also an organ donor. Individuals in the United States should donate their organs and act upon their decision to donate. Today I'll first talk about how being an organ donor is a life-saving opportunity. I will then talk about how a lack of education on organ donation and transplantation leads to the low percent of organ donors that we have currently in the United States, which leads to the organ shortage. Being an organ donor could allow you to save someone's life. Many people in our communities and across the nation need organs. According to organdonor.gov, which is run by the U.S. Department of Health and Human Services, there are more than 114,000 men, women, and children that are currently on the waiting list to receive organs as of April of this year. Organdonor.gov also states that each year the number of people on the transplant list continues to grow exponentially, while the number of transplant and donors only grow slowly. Registering to become an organ donor is a very important step in the process of becoming an organ donor. While approximately 95% of adults in the U.S. support organ donation, only about 50% of those are actually registered as donors. According to J.R. Rodriguez's article, Organ Donation Decision, which was published in the November 2005 issue of the American Journal of Transplantation, family members continue to play a large role in donation decisions. However, being registered is the essential part of being an organ donor. One organ donor has the potential to donate a variety of different organs, and according to medlineplus.gov, experts say that organs from one donor could save or help to save up to 50 different people. Organs you can donate include internal organs like the kidneys, the heart, the liver, the intestines, and the lungs. The skin can also be donated, also bone marrow and bone. Many people, however, are not educated on organ donation and transplantation, which leads to the low percentage of organ donors in the U.S. Becoming an organ donor is not a difficult process, and according to WebMD, if you wish to sign up as an organ donor, you can sign up on your state's organ donor list website. This is the first place that a hospital will check to see if you're an organ donor after death. Another very easy way to sign up is to check the box when you get or renew your driver's license at the DMV. And there also are a variety of myths about organ donation. According to Mayo Clinic, which was updated November of 2017, many people think that an open casket funeral is not possible if you're an organ donor. However, organ and tissue donation do not affect being able to have an open casket funeral. Another common myth is that a donor's family often gets additional medical expenses. However, Mayo Clinic also debunks this myth. The person that receives the organ is actually responsible for those costs. Lastly, many people have the ethical concern or myth that the organs that they donate might go wasted to someone who's ruined their own organs through alcohol or drug addiction. However, according to the Center for Organ Recovery and Education, less than 5% of people on the organ transplant list have destroyed their own organ through substance abuse, and those individuals are actually required to be sober for an extended amount of time. Lastly, many people argue that religion can play a part in an individual's decision not to donate their organs. However, while we all may not agree about the afterlife, we all can agree that you can't take your organs with you when you die. So today I first discussed how being an organ donor is a life-saving opportunity. I then spoke about how a lack of education on organ donation and transplantation leads to the organ shortage that we currently have here in the United States. So you could save someone's mother, someone's father, or someone's little girl. Agree to become an organ donor now and make the difference between life and death.